Thank you so much, Dr. Brown, for joining us today. We really appreciate your time and your expertise on the podcast.
It's my pleasure, Jenny. Thank you.
Thank you so much. So just to introduce Dr. Brown, Dr. Vivien Brown is a Toronto-based family physician and author with major interests in women's health, continuing medical education, and vaccine-preventable illnesses. She is the chair of the HPV Committee of the Federation of Medical Women of Canada for more than 10 years and played a crucial role in expanding the eligibility of the HPV vaccine to cover self-identified boys and girls. In 2017, Dr. Brown presented HPV initiatives in Canada at the UN meetings for the Commission on the Status of Women. She has been recognized by the College of Family Physicians of Ontario as Physician of the Year for the region of Toronto. Thank you so much for joining us, Dr. Brown.
It's my pleasure, Jenny. Thank you.
And I'm so excited to chat with you about kind of where we're at with HPV vaccination, what we're doing well at, and what we can improve in the future as well. So just to start things off, as someone who is such a strong advocate for HPV vaccination, I'm wondering what you see as the role of family physicians in the prevention and management of HPV-related diseases.
Well, it's a really good question because I think, unfortunately, although we've had vaccine available for boys and girls in every province and territory for about the last 10 years, Canada is generally under immunized. And really, what that means is we're not taking advantage of what we have to prevent cancer. And I think for family doctors, for primary care practitioners, nurses, pharmacists, the messaging has to be consistent. The messaging has to be that this is all about cancer prevention. And you want to get immunized and you want to have your children immunized so that we start to see numbers that are high enough to give us herd immunity, immunity in the general community, because there just isn't a lot of HPV around, so that even people who aren't immunized get benefit. And we're far from that. You know, the World Health Organization recommended that for women under the age of 17, that we hit a 90% vaccination rate. And Canada is nowhere near that. And if we're going to eliminate cervical cancer in the next 10 to 20 years, we need to get up to that 90%. Unfortunately, with COVID, we saw a real drop off in immunization in the school program. So we're very far behind. And the messaging, family doctors have to stay on this. It's not just public health, it's not just getting vaccinated in school, which is great. And that's what we should be doing. But the school programs are anywhere from 20% to 50%. They're not upwards of 90%. So we need to do better.
For sure. And I saw the latest statistics. So we mentioned 90% as the number that we need for herd immunity. But unfortunately, in 2023, Health Canada found that only 76.1% of adolescents 14 years received at least one dose, and only 66.8% received two doses in 2023. So we're definitely not hitting the targets for
Exactly.
90%.
And you know, we're so privileged in Canada. We have public health availability of vaccine. We have school-based programs. We have pharmacy-based programs. But somehow people just don't have the understanding that this is all about cancer prevention. And what we do now will pay off in the next 10, 20, 30 years, but we have to do it.
Definitely. And another kind of building off of that, cervical cancer is increasing at a very alarming rate of about 3.7% every year since 2015, and it's now the fastest increasing cancer in females. So I'm wondering what weaknesses right now you see in our screening, vaccination, or patient education strategies that we can improve on. I know we chatted about patients not often having the awareness that HPV vaccination can prevent cancer. So I'm wondering what we can do better.
Well, I think we have to do everything better. We have to do screening better. And, you know, in certain provinces, there now is self-screening available so that if women are uncomfortable going to the doctor, don't have a family doctor, live in a rural or isolated community, they can still screen themselves, send it in, and find out if they're at risk for HPV-related cancers. So I think we need to do a better job in screening. And what I would say, and what the Federation of Medical Women has said in a task force review, is that there's no wrong door. There's no wrong door for screening. There's no wrong door for vaccination. You can get it in a variety of different ways, but it needs to be done. Once we've done screening, we need to follow up on people who are positive, because if you get lost to follow up, you're taking a great chance of having increased disability and increased abnormalities. And I think we need to do a better job with vaccination. We need to make it routine. We need to normalize the discussion. So it's not just for boys and girls, men and women under the age of 26. There's no upper age limit in Canada. And we need to be immunizing because we are seeing head and neck cancers and a second peak in cervical cancer in older women. And we can do better as a country if we are more vigilant about immunization.
Definitely. And I think even for myself, just a few years ago, I did not know that HPV can cause things aside from cervical cancer, like head and neck cancer, for instance. So I think it's definitely a very important message to pass
The
on to
other
our
thing,
patients.
Jenny, is that I think it's really important people understand that when they have a cervical abnormality, it means they've had persistent HPV. They've been identified, they identified themselves as having persistent HPV. So they are at greater risk for HPV related cancers in other regions. Women with cervical cancer have a tenfold increased risk of rectal cancer. There's an increased risk of vulvar cancer, vaginal cancer. So even if someone has had a cervical abnormality, a pap test abnormality, and they weren't immunized, it's still worth it to be immunized because it decreases your risk of recurrence and it decreases your risk of HPV in another location. So this is a really important message. When we immunize for measles, we prevent an infection. When we immunize for HPV, we prevent a cancer and the risk of cancer in other locations. And that's why this vaccine is so powerful and so important.
Definitely. And I think it's not every day you have a vaccine that can prevent cancer, of all things. So, very
Exactly.
important message, certainly. And in Canada, earlier you mentioned that we now have different ways of screening for cervical cancer. And in British Columbia, actually, patients in certain regions of British Columbia, patients are able to choose between HPV self-sampling versus physician collection via a pap smear. So I'm curious what direction you see sampling strategies progressing in the rest of Canada in the future.
I think it's important that we give women options, and I think it's important that we are working to get the underscreened women of different ethnic backgrounds, women who live outside of the main city, women who may not have a family doctor, and that's what self-sampling can achieve. But in order to do it properly, you need a program because you need a way of record keeping about who's been sampled, what that sample showed, when they need another sample. So it's not just a single step. It's not just the self-sampling, send it in and you're done. There needs to be the infrastructure or the record keeping to know who's been immunized, who's self-sampled, and where their numbers are, because we don't want women to slip through the cracks. We don't want women to do a self-sample, never hear back from anybody, presume that it's okay, and then find out a year or two later that it showed a significant risk for disease.
Definitely. And the program in BC, they offered it on Central Vancouver Island and the Sunshine Coast, and they later expanded to include other regions as well. And it's like you said, the data actually showed an increase in the number of people who have never been screened or not screened in 10 years. So they weren't willing to undergo a pap smear, which is very understandably much more invasive because it involves somebody else doing the collection. So I think it's very reassuring that this data is showing that this offering another mechanism is allowing more women to feel empowered to undergo screening.
Exactly. And one of the things that COVID taught us is that you can do self-sampling. Self-sampling can tell you whether you're COVID positive or COVID negative. And so certainly as we start to have more opportunities for screening, we can offer women various choices. Some women prefer to be seen by their physician, prefer to have a pap test. They want someone to take a look. They're not sure they've done things properly. But we have some people that are overscreened, sort of the worried well that keep coming back and really don't need it. And then we have the underscreened, the people that haven't been screened in 10 years or have never been screened. And so I think we have to offer women a variety of choices because different people are comfortable with different opportunities.
Definitely. I think just having more options for everybody based on their preferences is so important for preventative health.
Exactly. And if a woman has cervical cancer, she may not understand that it was HPV related. And we need to do that level of teaching so that She can help her children. She can help her partner. She can help the people around her to prevent this disease. So I think self-sampling is really important, but it needs to also come with the education as to why it's important, what we're doing, and how we're doing it.
Definitely. And I know you're such a passionate advocate for patient education. And I'm wondering, how can we address the ongoing misconception that, HPV is exclusively a medical concern for women or younger patients? What are some opportunities that we can take for patient education?
But I think this is one of them, Jenny. It's people like you doing something like this, trying in social media to do some education, trying online to do some education. It's not all about the classroom, it's about communicating with people the way they communicate. And I'm of a different generation. I'm not an expert at TikTok, but I understand TikTok is very powerful and people get a lot of information from that. And what people need to understand is HPV is a virus leads to cancer. We have a vaccine against the virus. It's a very simple message, but it gets convoluted sometimes when people talk about sexual transmission, when people are anti-vaccinators or vaccine hesitant, and we need to make the message very clear, communicate it very succinctly. World Health Organization has a number of different statements that they've made, and the bottom line is we are at a stage in our life as Canadians where we can eliminate cervical cancer in the next 10 to 20 years. People in the 50s were afraid of polio, and we don't see polio anymore, although there's been outbreaks in war-torn areas, and we know that the polio virus has not disappeared. Well, we can eliminate HPV. We can certainly do it in Canada. They're doing a much better job in Sweden, in the UK, in Australia, and we can do a better job as well. So we need to make the messaging very clear, and we need to get it to people in ways that they understand. And so if TikTok is the way, then TikTok is the way to go.
Definitely. Patient education, I think, such an important step in preventative health and empowering patients to kind of take control of their own health as well. So it's not just physicians telling them to do this, do that. They understand why they're taking certain actions for their health. And I think that's one of the most important things we can do.
And one of the other things that I really believe in is collaboration. And the Federation of Medical Women of Canada is collaborating with the Ontario Dentistry Association, with the Canadian Dentistry Association, because what we know, for example, in head and neck cancers, it's much more likely to be found by a dentist or a dental hygienist than it is by a doctor. So we're spreading this message about cancer prevention, and we're spreading it not just to other family doctors, not just to other specialists, but to people who were not necessarily primary vaccinators. So we need to all have the same message so that patients hear it clearly. And when you talk to people about quitting smoking, they need to hear it about 7 or 8 times before it really registers. I think with HPV, it's similar. People need to hear it from different sources and understand it's not just about an individual's choice. It's really about understanding the risk of the virus.
Definitely. And in the spirit of collaboration, I'm wondering if there are any clinical pearls related to HPV care that you would like to share with colleagues or with our listeners in general.
My own feeling is we need to normalize the discussion. So when we're talking about, mammograms, when we're talking about pap tests, when we're talking about colon cancer screening, we need to talk about vaccination. And HPV is one of those vaccinations. Yes, pneumonia, yes, flu vaccine, yes, COVID vaccine, but let's start talking about cancer prevention HPV vaccine. We do have another vaccine that prevents cancer, and that's hepatitis B. And our kids have been immunized for hepatitis in the school system, at least for the last 15 to 20 years. I think we need to start talking about HPV with every patient every day so that it becomes a normal conversation. We've normalized the discussion.
Definitely. Thank you so much, Dr. Brown. You're such an amazing advocate for HPV care in Canada, and I really appreciate you spending time with me today on the podcast. Thank you so much.
Thank you, Jenny. Thank you for doing this because it reaches other people and it reaches people that need to hear this message. It's all about cancer prevention.
Definitely. Thank you so much.
Thank you.